Joining us now is Dr. Carla Garcia Carreno with the Children's Medical Center in Plano. Thank you so much for joining us, Dr. Garcia Carreno. I feel like I've talked to you multiple times in the past few weeks.
Yeah, thank you for having me, Dia. That's right.
Tell us, what do people need to know if they may have been potentially exposed to measles?
Yeah, if somebody was exposed to measles, essentially need to monitor themselves for symptoms for up to 21 days after the exposure. Now, the following steps are going to depend whether the individual is vaccinated or not. If you're vaccinated and were exposed, besides monitoring symptoms, you can continue to your normal life, go to work, go to school. However, if you're unvaccinated, then you need to talk to your primary care physician as soon as possible, because there are some post-exposure prophylaxis that can be done, like vaccination or immunoglobulin, depending on the timing. And these people that was exposed and is unvaccinated need to isolate for 21 days while monitoring symptoms, because they may be contagious.
How would anyone know if they are exposed?
Well, if you had a contact with somebody you know had measles, that's a no-brainer there. But then also check on the health department webpage, as you were mentioning, that individual that traveled to these areas and with the specific dates. If you were there up to 2 hours after that individual left, you can still have been exposed to measles. And so keep updated with the news and the health department communications.
What more can be done to further prevent the spread, and who's most vulnerable or at risk right now?
So everybody can be at risk, but essentially the unvaccinated people are the ones that are most likely going to catch the measles. So you're unvaccinated and exposed, that's the most likely scenario. Anybody can have it. It used to be a childhood illness, but now we are seeing it more in young adults, especially traveling and bringing it back. And to limit the further spreads is vaccinating. Vaccinating is the best way and the only way that we have to prevent further spread. We need to have at least 95% of the population immune to protect.
Dr. Garcia Carreno with Children's in Plano, thank you so much for your help.
Thank you for your time.